The Community Wellbeing Show, at the heart of Boothtown, Shelf and Mixenden. The show that informs, involves and empowers the community.
Hello, welcome to the Community Wellbeing Show podcast. My name is Mark, and I'm the current chair of the Caritas Patient Representative Group. This podcast is a platform to inform, involve, and empower the communities across North Halifax and beyond. It's part of a regular broadcast talking about health, wellbeing, and general practice topics, answering questions directly from patients and the public. It's hosted by members of our Patient Representative Group, and this is a chance for our patients and the public to have a window into the happenings at the surgery and be able to ask defining questions. So this first episode is an update on our GP surgeries. And in this episode, we're going to find out a bit more about Dr. Ahmed and get an update on what has been going on at Caritas Group practice. And so it'll be an introduction from Dr. Ahmed, and we'll look at a timeline of events since he took over the surgery with his partner in 2019, some of the challenges faced around the opening hours, COVID and changes in the NHS, and a vision for the future. And then towards the end, we've got some questions from our patients that we're going to ask Dr. Ahmed live on this podcast. So over to you, Dr. Ahmed.
Thank you very much, Mark. And welcome to this, officially the first episode of the Community Wellbeing podcast. And I'm very grateful for our patient representative group, Mark, Cathryn, and quite a large group that we have, one of the biggest in the UK, over 20 members now, and you've all been amazing in setting this up as a platform, and I'm very grateful for that. And I think it's a really good way of getting the message out there and trying to sort of inform people of what's going on in general practice and beyond in the sort of the community elements of what goes on within this area. So we're hoping that this podcast gets out to sort of the North Halifax area. We cover Mixenden, Woodside and Shelf, and we have over 9,000 patients across those three sites. But we work alongside our primary care network in North Halifax, which is another 3 surgeries that we work with. And that's the total number of patients, close to 40,000, if not more than 40,000, in fact. So there's a huge population of patients that we serve in the area, and it's part of our job to inform patients about the services that are available to them and what goes on behind the scenes, because it can be quite complex, daunting, and very fast moving in this current climate. Things change very quickly, and it's not always clear what services are available. There's a lot of confusion sometimes, misinformation, and lack of awareness of what people have access to and what they can access. So we're here to try and give you this window into our practice as Caritas across the 3 sites and beyond, and allow people that sort of opportunity to ask questions of myself and the others. We'll have other staff members at the practice coming on the show in future, management staff, nursing staff, other clinical staff. We will be talking about different subjects, including non-medical subjects as well, that may be relevant, community projects that go on in this area, health and wellbeing projects. So it's going to be hopefully interesting and empowering for people. So please do keep an eye out and engage with the process on our social media and with our patient representatives to give us ideas of what you want to know about, any topics that people want to talk about, and we will respond to that accordingly.
Okay, that's a great introduction. So should we go on to the next item, which was a brief time of events since you took over the surgery in 2019?
Yes, so myself and Mr. Imran Khan came on board as partners in mid-2019, and it was a couple of months before we were sort of formally became partners at the organization. And by the time we were able to get our feet on the table, so to speak, we had a pandemic on our hands in March of 2020, and it's a blur after that, really, the past two years or so. And we really did go into the deep end of general practice, and in terms of the entire focus changed. And we started with a kind of a vision, a plan of action, a strategy of where we wanted the practice to be. It's no secret that there was a lot of work that needed to be done at Caritas, and there were many areas that we were hoping to work on and improve the practice. But the focus shifted to COVID, and trying to sort of manage the situation through the pandemic and then the vaccination program. So it really was a difficult struggle to try and sort of get the practice to where it needs to be, as well as trying to maneuver through a pandemic. But we've got through it. We've got through the whole process with the support of our patient representative group and a brilliant management team. And over the last 12 months, we've had an entirely new management team in place, management structure. The majority of the admin staff are new within the last 12 months. I'd say over 80%. The secretarial staff, we've had new nursing staff recruited over the last 12 months. We have a full team now, finally, at the practice, and that includes clinical as well as admin, secretarial, management, and we are staffed now better than we have been since taking over in 2019. There are still a number of areas that we are working on, and we want to develop key areas to get to where we want to be over the next couple of months. But now, we're there, I think, and Cathryn and Mark, yourselves have been involved in the whole journey in the last 12 months and seen the progress that we've been making. So it's all positive.
Okay. Let's talk about some of the challenges and things like opening hours, COVID, and changes in the NHS.
Yeah, absolutely. So the practice, there's 3 sites, and 2 of those are what we call branch sites, and they were half-time opening hours from 2018, if I recall, and that was again a decision made at the time by the organization because of staff shortages and various other issues at the time, and there were difficulties that meant that they had to kind of reduce the working hours to try and for the practice to survive, basically, at that time. And it was a big hit for the community and for the patients, as we can imagine, not having that access for half the week. The access was there, but it was at the main site, Woodside, and obviously it was a big hit to the local people. And when we came on board, it was one of the main areas that we wanted to go back to full-time opening. But again, because of the pandemic, our priorities had to change and the staffing issues continued. And we worked in the last 12 months to get back to opening hours and being able to have all the services, such as blood tests, face-to-face appointments, and nursing appointments at all 3 sites throughout the week. And we're halfway there. We've done a big proportion of that is happening now. We have blood tests at branch sites through the week. We have face-to-face appointments. We have access at the branch sites for more than 50% of the time of both branch sites. And Mixenden is open 4 days, Shelf 2 days at the moment. So we are working over the next couple of months to try and get back to full-time opening and full-time services all across the 3 sites.
Okay, and then what about the impact on COVID? Is it still impacting the surgery?
COVID, it's not as significant. The vaccination program is not as high pressured as it was. The last phase ended in January, and since then, I think things are now a bit calmer in terms of the pressures of the vaccination program. In terms of the pressures of staff sickness, we're not obviously the numbers are rising again in the last 2 weeks in terms of the cases. So we can never really be sure what's around the corner with COVID. But at the moment, we're in a good place where the numbers are stable in terms of staff illness, in terms of the numbers we're getting reported positive cases, and the impact of it at the moment, it seems to be manageable.
Okay. And what about changes in the NHS? Are there any changes coming down the pipeline or challenges that you think patients should be aware of in terms of the NHS changes for the surgery?
There's always something going on with the NHS, and we're defined by the sort of changes in politics nationally sometimes and locally. It is quite a lengthy sort of discussion to get into, but the PCN, a primary care network, which we'll talk more about in future episodes, and I hope to get other guests on who can talk about their roles within the primary care network. But this came into force again in 2019, just before we came on board as partners. And what it meant was that the services provided are shared amongst a group of different practices. So we partnered with 4 other practices. Now it's 3. So there's a total of 4 practices that we are in this primary care network. And it basically meant that the services that we are able to offer, such as physiotherapy, blood tests, social prescribing, mental health practitioners, are shared amongst those 4 practices. And we have more resources. So in essence, it's all for the benefit of patients, to give them more access. So rather than referring patients to the hospital to go and see a physio, it means that the physio is available on site at one of the 4 practices, and we can refer in-house basically. And that's the whole point. And that's why the primary care network was kind of set up. So that's one of the main areas, and the primary care network is developing and recruiting more staff members, such as podiatrists, and all sorts of other things are planned, which we'll hopefully talk about in future episodes.
Okay, thank you. So the next question in a sense is, what's your vision for the future for Caritas? So you've been there 2 years now, and so patients are always interested to know what the GP's vision for the surgeries are. So what's your vision for the future?
Yes, absolutely. I mean, the vision is what it was when we started. It was put on hold, unfortunately, for the best part of 2 years. And as we've had many discussions in our PRG meetings. I've always maintained that, we had a list of things that really I came in with the view to get those done, and we've been committed and focused to get that done. And I've been anticipating the time that we can get on and do those. In essence, one of the main focus points for me is access. Access has always been an issue, especially at the branch sites. And I've always, whenever I've spoken to patients, that's what's been the most stressful and most, I suppose, the issue that people are holding on to is losing that access 4 years ago at the branch sites. So for me personally, that has always been a top priority, because I've never felt it's been a fair representation, and it's not fair on those patients, especially when we have certain areas where there are elderly patients and those that cannot get to the main site in Boothtown. It's not fair on those patients to have to travel there for a face-to-face appointment or a blood test or a nursing appointment. And I feel that part of providing a service as a general practice, as a community organization, as we are healthcare providers, it should be accessible. It should be there for everybody and not be difficult to access. So for me personally, that's a big target for me, to get the access back to where it needs to be at 100% across all 3 sites. And I think that in itself will solve a lot of those problems and bring back a lot of confidence in the practice.
Okay, thank you very much. So Dr. Ahmed, we've got some questions now from the audience, and we have some patients' questions we'd like to ask you. And this is 2 patients called Jim and Pat, and they are part of a PRG, but they've posed some questions that we'd like to ask you. So the first question is, with shelf surgery due to open 4 days a week in the near future, What big changes, if any, can patients expect to see compared with what it was like before the pandemic?
Well, I don't know really what it was like before, because I kind of started working here late 2018, I think, around about that time. I can't remember exactly. So I've never really known it to be open fully, and
Okay.
I wouldn't know what to compare it to. So maybe patients that remember the good old days maybe would know better as to what it would have been like. From our point of view, my, again, going back to the vision, is that general practice should be more than just somewhere where people turn up when they're unwell. To me, it needs to be a center of activity, a community hub, a place where people can come and go, people can have other activities going on as well. And we've already started that here at Shelf Surgery with the coffee mornings. We did the walking group as well that Cathryn's leading on. And these are some of these activities, and there's so much planned, community champions and various other activities and events and well-being things that we want to do. So to me, I don't know what it was like, but I know where we want to be. And that's being part of the community, center of the community, especially now post-COVID, and so many of the resources are being lost. Up here at Shelf, we're on the verge of losing the village hall, and so many community activities and resources are being lost, unfortunately, for whatever reason. And I think we, as general practice, need to make a stand and need to be there beyond just providing services and healthcare when people are unwell. We need to be proactive in promoting health and well-being as well. So that's the vision, that's the hope, and I would like to see our surgeries and branch sites as places of activity and hustle and bustle, and young and old. It's not just somewhere where people are really unwell and elderly that come to ask for help. Youngsters, young people, kids, we need it to be a place of action and alive, really.
Okay. So next question we've had from Jim and Pat is that most older patients, those 70 plus, are used to having a surgery where they can see the doctor, not necessarily for a medical problem, but just for a chat, especially the older people maybe lost a partner. How do you see this in the future as more and more appointments are handled on the phone?
Yes, again, it goes back to the point we've just discussed, is that not everything is a consultation. Not everything is about speaking to a doctor or a clinician in the sense that we need to recognize and look beyond the physical nature of illness. Sometimes there is social isolation, there are issues of loneliness and issues of just having a conversation. People just want to speak to somebody and just want to get to know people and see people. So I think we need to, again, create that environment and create that openness. And again, the GP surgery is a potential for that place is potentially that place where you can have. So why restrict it to a 10-minute consultation with a doctor over the phone when we can have workshops, when we can have group sessions? Maybe this is where the coffee mornings come into play as well, where people can come together and talk. So I'm hoping, yes, these things can come into action.
Okay, thank you. Next question then. With more and more people now suffering from mental health related ailments, what's the practice's vision for the future on handling these?
Well, again, it goes back to the same kind of point again, where a lot of these communal activities, physical face-to-face workshops, well-being activities, it all goes hand in hand, sorry. And the PCN will have a big role to play in this because of the mental health practitioners, the social prescribing. So once these roles are better understood and incorporated into practice, I think our patients will start to understand and be able to get the most benefit out of these services. So I think it's just connecting all those dots and seeing the sort of holistic care of our patients and community in a global sense, and working together with other agencies to provide the support needed, because it's not as simple as a 10-minute consultation and prescribing somebody something. There's so much more involved and needs to be involved. And I think we need to, again, have more creative ideas and creative ways of doing things.
Okay. Last question then, before I've got a query at the end, but this is just a question then, so last one. Does the practice have any future programs to make people aware of the following things: obesity, prostate problems, heart disease and diabetes?
Yes. Again, this platform here as the podcast, as I said at the beginning, we're asking that question of the public, those that are going to watch this, and our patients, and if there's any topics that people want to talk about, or want me to talk about, or we can get other people coming on the show to talk about. So the common subjects would be heart disease, hypertension, diabetes, high cholesterol are the common ones. So we will start compiling a list with the help of the PRG team, and then work through that list depending on what the appetite is out there. People may want to talk about cancer, may want to talk about prostate cancer, breast cancer, many other conditions. So it's now a case of seeing what people want to talk about, want to learn about. And this will be one platform, this podcast, but we will start doing maybe workshops face-to-face within the practice. So if there's enough demand for people to say, we want to know more about diabetes, we'll put a workshop together in the surgery. People can come in and talk about it and share their experiences. And so these are things that we have planned, but it's all going to be dependent on how people respond and what the appetite is out there to talk about.
Okay, just before we close, and we've got a question from Cathryn. Cathryn, who's with us at the moment. Cathryn, I hope you don't mind if I ask your question, but I think Cathryn had asked if at some point on a future podcast we could do a demonstration of the online consultation system. In the PRG group, as a patient, we've promoted it, and we were involved in the pilots, and it was something that we chose, and we think it's a really good system for those that are savvy with technology. And we know it's not exactly a question, but we'd like maybe to ask for a future demonstration or a separate podcast, just a quick run through of how to access the system.
Yes, definitely. E-consults, we as a practice are the leading practice in Calderdale in terms of the numbers that we process, over 70 to 80 a day that we're doing. And those that have used e-consults rarely go back to ringing the surgery, because I think Mark, yourself, you've experienced that as well, where it's as simple as doing a text message in your own sort of time, your own convenience, and you can put in the information that you want. You can ask for a time for a callback. You can ask for a clinician of your choice. So it really is there to make patients' life easier. And I think a lot of what we need to do is kind of inform people on how to use such a sort of technology and the reasons behind it, because the trouble we have sometimes is that people presume that it's a barrier. It's seen as a barrier, and comments such as, well, we're getting fobbed off with an e-consult, which isn't the case. It's actually a tool to make it easier for patients. And I think sometimes it's that barrier, and the way we explain things isn't good enough sometimes. So yes, definitely, I think we can have a specific focus on demonstrating that and talking more about how e-consults are done and how easy they can make things for patients.
Okay, and just before I finish, Cathryn, have you got any questions for Dr. Ahmed?
Yeah, what struck me as we're doing this today is that there are a lot of people, especially older people, that aren't on the internet. They don't have any internet connections. So I'm just wondering if there's any way that we can get this sort of information out to those people that don't have access to these podcasts. Because you've given such a lot of information there that was really useful. And I mean, like for example, about the PCN and all that, I didn't know all that. So it's really useful to me, and I'm sure that it will be useful to a lot of other people. And it also may help them to understand why everything isn't at shelf. And so I'm just wondering what the best way is of getting that information to them.
Yeah, it's an ongoing challenge, really, because from our point of view, it's a two-way process. We can only do our best in terms of how much we get as feedback from our patients, and that's what you as a PRG group have done over the years. And we've tried different methods, and we are trying different methods. We have a newsletter that goes out every couple of months. This is a new approach, and the hope is that maybe those family members that are younger and have access to the podcast may share this information, maybe help the older people watch it, or give that information to them verbally if they know any different. But we will obviously be looking at other options, and those face-to-face workshops and coffee mornings perhaps is a way to do that. But I don't know really what the answer is. There are patients who are housebound. There are patients that we have who are quite elderly in certain areas and isolated. So it is very tricky to really get the message out there to everybody. And I think it takes a team effort. And when I say team, I don't mean just as the staff at the practice, but the community, the patients that we have, the local pharmacies, the local hairdressers, the local town criers. We need to get the message out there, and people to get the message across that this is what's happening and these are the changes that are happening. And if people do have suggestions, whether it means posters, whether it means dropping off flyers into people's homes, or asking the local councillors when they do their round of their regular flyers, maybe adding a piece in there, which we did recently up here at Shelf. We had a small segment, and that seemed to get the message across quite well. So maybe it's something of that nature. Just put it in with the local delivery, takeaway delivery menus or whatever. I don't know how you get the message out there, but we're open to suggestions. And if people have any creative ideas, we're more than happy to listen and try and sort of get the message out there. Well, that reminds me, getting the message, the Shelf Gala is happening this weekend. So we have a stall at the gala with yourself, Cathryn, with the Wellbeing Community Group. And again, that was suggested by somebody on our PRG as potentially a good way of trying to get the message out there. So I hopefully will be there and to answer questions. And I'm hoping that could be another way of getting the message out there and for people to ask questions and get more information.
Okay. Well, thank you very much, Dr. Ahmed. Thank you on behalf of the patient representative group. And that concludes the end of our first Caritas Community Wellbeing podcast. Thank you very much.
Thank you.
You've been watching the Community Wellbeing Show. Don't forget to like, subscribe and share, and join us next time for another episode.